Joining us now is Dr. Raymond Aguboshim, the current Vice President, West Nigeria Optometric Association. Thank you so much, Dr. Aguboshim, for joining us again.
Thank you. Good afternoon. Good afternoon,
Good
Central, for having me. Thank you, and thank you to our viewers.
It's a pleasure.
At home. Thank you.
All right. Very quickly, Dr. Aguboshim, a lot of times when we talk about poor eye health, many people don't know what the causes are. So can you quickly tell us what causes poor eyesight over time?
Okay. There are several reasons, or a lot of reasons, but let me classify them so we'll be able to understand them a bit more. I'm going to classify them in terms of how they happen. There are some that occur while you're still in the womb. There are some that occur while you're already born, and there are some that occur as you grow older. So in that case, we have what we call congenital conditions, which are the ones that happen before you are still in the womb. Then there are the ones that happen during childhood, and then the one that happen at full age. So in this context now, anything that happens before you were born, to a reasonable extent, you don't have a role to play in it. But the ones that happen from the time you were born, at the point you're still under the care of your parents and guardians, and then the ones that happen when you're a full adult, you have full responsibilities. So in this context now, all the conditions we are going to look at are all fall into either in one of these categories. For example, we have issues we call refractive error. We have refractive errors. These are the major cause of poor eyesight. We have things like glaucoma, which is the leading cause of irreversible blindness in all ages. And then we have cataract. We then have things like trachoma and the rest of them. But I'm going to focus on these three major ones: refractive error, which is, in this context, we're talking about long sight, short sight. In this context, we're calling them myopia, hyperopia, astigmatism, presbyopia. Now, myopia is about short-sightedness. I'm making everything short. Then hyperopia is long-sightedness. And then you have astigmatism. In this context, you see things, but you don't see them the way they are meant to be. You have a different concept of what they are as against what they actually are. And then we have presbyopia, which is an age-related issue that usually happens to people from their mid-ages into their old age. In that context, they have difficulties reading tiny prints. On the other hand, we have glaucoma, which I mentioned earlier on, that is the leading cause of irreversible blindness. In this context, the person can actually go blind 100%, and there's nothing you can do about it. So in that context, we look at what can you do to even prevent it from manifesting, and then we also talk about cataract and the rest of them. So I'm highlighting the three major ones: refractive error, glaucoma, and cataract. Thank you.
Okay, so a lot of times, many people find themselves caught up in the web of using their gadgets, their laptops, and even for workers like us, for example, exposed to so much light in the studio. How can one prevent poor vision, having been exposed to all of these things?
Okay, I'm going to still make it a general thing. Let me just not restrict it to just people in the studio and things like that. For example, this year, we're talking about the World Sight Day today, and we're focusing on kids. Now, I'll use kids as a template to extend to any other person out there. So, you're talking about issues that could lead to poor eyesight. You're using the case study of lighting in the studio. There are things you could do. First of all, you could reduce your screen time. Most times we encourage people to reduce your screen time. The era of paper, pen is beginning to phase away to the era of computers, phones, and everything. We now do everything online. But then it comes with its own challenge. You need to actually be online. Then anything that can be done outside of the net is very encouraged. For children, for example, as we're talking about today's case now, we encourage them to actually do more outdoor things. Gone are the days when children play on the school fields. Now everything is done online, which is not helping because we are looking at the global statistics, which is telling us that about 450 million children across the world have significant eye health issues. And if care is not taken, by the time we are in 2050, which is barely 26 years from now, half of the world population will develop a very significant eye health issue. So in terms of controlling this, we are mapping out strategies. One of them, you're talking about the studio, is like I'm wearing a prescription now. This is not just a plain prescription. There's something we call the anti-blue device. In this case, it helps manage the blue rays that come to you from digital devices, from the workplaces. There is also the photochromic lenses. This help control the light that hits your eyes. And then, above this all, regular eye exam is a factor that must be considered by everybody, because it is in this regular eye exam that you'll be able to note if there is something threatening your vision, and then appropriate technical professional actions can be taken on that. Thank you.
All right, Dr. Raymond Aguboshim, thank you so much for joining us and shedding more light on eyesight and the causes of poor eyesight. Thank you once again.